Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing pilonidal cyst. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So what is a pilonidal cyst? So it's a cyst that you get at the bottom of your tailbone or coccyx region. It can become infected and filled with pus. Once it's infected, it is called a pilonidal abscess, okay? It can be very painful. So it looks like a large pimple at the bottom of your tailbone, okay? It's more common in men than women. It usually happens more often in younger people, and people who sit a lot, such as truck drivers, have a higher chances of getting them, okay? They can be treated. If the cyst becomes a problem, the doctor can lance it and drain it or actually surgically remove the cyst. So what causes a pilonidal cyst? So most doctors think that ingrown hairs are often the reason. Pilonidal means a nest of hair, and doctors often find hair follicles inside of the cyst. So when they go to open it up and drain it, there's normally hair follicles in there that need to be removed. Okay, another theory is that pilonidal cysts appear after a trauma to that body region. You might be more likely to get one if you were born with the small dimple in between your buttocks. The dimple tends to get infected. Doctors are really not sure why, but other risk factors include obesity, large amounts of hair. So if you're hairy, you're more at risk because this doctors do think that it is caused by ingrown hair. So if you have more hair, you're more at risk. If you're not exercising enough, if you sit for prolonged periods of times, or if you excessively sweat. So what symptoms might you experience? So pain, redness, swelling at the base of the spine. Sometimes it will start draining itself if it's ignored for too long. So you might have pus or blood. You may have a bad odor coming from that drainage. It will be tender to touch. You may have a fever, okay? Pilonidal cysts and abscess, they can vary in size from small to large, big, painful areas, okay? So when should you call your doctor? So just like other boils, they are not going to get better by just taking antibiotics. They do need to be drained, okay? So sometimes we use hot compresses, a warm bath to soak in, and it will start draining on its own. Even some topical creams doctors sometimes use. In more severe cases, it needs to be lanced to heal, okay? Like I said, with other boils, they are not just going to heal with an antibiotic. They do need to be drained. So diagnosing this, your doctor will be able to do it, diagnose this with a physical exam. And they normally just ask a few questions. When did you first feel it? Have you ever had this problem before? Because these pilonidal cysts sometimes tend to be reoccurrent if the sac is not removed, okay? They want to know if you've had a fever and what medications or supplements are you on. So since they can be very uncomfortable, painful, especially if you're sitting, have to sit for your job, is very irritating the area. So early in the infection phase, the redness and swelling and pain, it might not be too bad, but some things to ease the pain you can try. Like I said, soaking in a tub of warm water. This sometimes opens it up where it can start draining on its own and release that pressure, because the pressure is what's causing the pain, right? And then the infection, obviously, redness, inflammation, it's going to add to it. You can also take non-prescription pain medication, just follow the dosing instructions. And then you want to keep the cyst and area around it dry and clean, okay? Okay, so now we're going to go over the different treatment methods. So like I said, antibiotics are not going to heal a pilonidal cyst, okay? So we do need to drain it. Okay, so how are we going to drain it? Sometimes we do an incision and drain. This is the preferred method for the first pilonidal cyst. Okay, so this is the first time somebody's had it. So they remove any hair follicles and they leave the wound open, packing the space with gauze. Okay, it's a super simple procedure done under local anesthetic. Disadvantage is that you have to change the gauze often, so the packing where that cyst is, so it can grow out and heal. Sometimes this can take as long as 3 weeks. Okay. The next one, we have marsupialization. So this is a procedure that your doctor has to be specially trained for, where the doctor cuts and drains the cyst, removes any hair particles that are in the inside of it, and then they sew the edges of the cut to the wound edges to make a pouch. Okay. Advantages, this is an outpatient surgery, local anesthetic. You don't need to take out or replace packing. It's not needed. Okay. Disadvantage is this can take up to 6 weeks to heal. Okay. Once again, the doctor does have to be specially trained in this method. Incision, drainage, and closing of the wound. So just like the incision and draining that we spoke about above, this technique, the doctor will cut open the cyst and drain it, but it's not left open. Okay, so you don't need to pack it daily because the wound's fully closed. So they'll just stitch it right up. The problem with this is that you're more likely to have problems down the road. Okay, because how wounds work. So now you have this kind of tunnel, and they can be quite deep. So you have this tunnel here, and they're going to sew at the top. Okay, see how there's space in between my fingers? That's where the problem lies. Okay, it's easy for it to fill back up again. Okay, especially within the first few days. So it can fill back up, become infected. Okay, with the incision and draining, when we're packing it, so we're going to pack it and we're going to slowly get it to close. Okay, as you pack, it starts, the base of the wound starts growing up towards that packing, and it fills all the dead space, so we don't have a pouch there. Okay, sometimes they try this method, sometimes it works, sometimes it doesn't. So after the surgery, you want to make sure that you're following the doctor's instructions, depending on what they did. But other tips, just try to keep the area nice and clean. You can wash the area well, especially after a bowel movement. Check for any signs and symptoms of infection, redness, pus, pain. If your pain is getting worse after surgery, make sure you follow up with your doctor. Keep any follow-up appointments with your doctor so they can see how the cyst is healing. A complete cure is possible, but remember, with pilonidal cysts, they may reoccur. Even if you've had one surgically removed, they can happen again. That's why I say they're kind of a reoccurrent thing. That's why when the whole stitching things, it can be difficult because you can get them more frequently. When you're at risk, you're already at higher risk for another one. So I hope this video did give you a better idea of what a pilonidal cyst is. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.